Hi, everybody. Welcome to another installment of our Insider Perspective series. I'm your host, Brianna. And as you know, Nurse Step is a site that is built by nurses for nurses. And we aim to provide a collaborative social space for nurses across all levels in order to share resources, guides, camaraderie, humor, work life, sanity savers, and we are big proponents of gathering as many voices in nursing as we can. Today, I am joined by Alisia Granville. Alisia is a self-described transformational leader who works to develop nursing leaders and promote nursing excellence. She has an extensive background, both clinically and in administrative work. And currently she works as a nursing leader and she's developing the Nurse Manager Coach. And we are going to get more into that as we talk this morning. So welcome, Alisia. Thank you for joining us.
Thank you. Thank you so much, Brianna, for having me.
Yeah. We always like to start at the beginning. I always find it so interesting how everybody gets into nursing. Can you share with us how you got started with nursing?
Yes. So, interesting story. Growing up, I'm from the South, originally from Birmingham, Alabama.
Okay.
I went to a Southern Baptist church, and they have this committee called the Nurses Guild. And
Ah,
these ladies that wear crisp white uniforms,
okay.
hats, stockings, and white nursing shoes, white.
Wow.
And they are in place for people who get a little bit too excited during the service. So they come,
Interesting.
they offer you a fan. They
Okay. Wow.
it's amazing to watch. And
Yeah.
line they sit together. It is so uniform. So they're there to help.
Yeah.
Sure, their role was expanded, but as a child, this is all I saw. I saw them just
Right.
going in to the rescue.
Right.
People that got too excited or got too hot, in
Yeah.
church, and they would help them. And they would, if ladies were to pass out or have some kind of sinkable episode, they would put a blanket over their legs to show dignity.
Right.
So it was very pristine. So I saw that growing up. And then my father was the
Mhm.
other influence. At the time, he was married to a nurse. He introduced me to that profession, had her speak to me. She was a NICU nurse. And
Mm.
they even went so far as to adopting one of the children that she was taking
Wow.
care of. One of the
No
babies
kidding.
got left in a nursery, and my
Oh,
father and his wife adopted the baby. So the compassion that
yeah.
wife at the time showed, I was like, wow, this is amazing. And one of my good childhood friends had gone off to school. The seed was planted, but I wasn't quite sure
Right.
where I was going to go. Childhood friend decided to major in nursing. We didn't go to the same college, but that was the last piece of inertia that I needed. So
Yeah.
I kind of got into nursing.
Interesting. Tell me again the name. It's the Guild,
The Church Nurses Guild.
the Church Nurse. I have never heard of that before, but you painted such a vivid picture. I can picture the whole thing with just
Absolutely.
being in, the heat in Alabama, and I'm sure, there's no air conditioning in there. And
Yes.
wow, that
And
is
crisp
that's
white uniforms and white gloves and white shoes. They had the entire nurses out.
wow,
Yeah,
that's very
quite
cool.
impressive.
um, Tell us, what is your biggest passion right now, and do you use that to keep yourself motivated?
So my biggest passion is the need. There's always a need in healthcare, and
Yeah.
it keeps you wanting to help. I'm a natural helper. I want to help and do things. So the need. And nurses are the heart of the hospital.
Yes.
Without nurses, without good leadership, without good nurses, the system, the patients, and the community will
Right.
suffer. So
Right.
the need, that's my passion.
Yeah. That very well said. I like that. Um, as a leader and as a leader who develops other nurses to come up as leaders, um, how do you continue to grow yourself as a leader?
Oh, yeah. So I'm very active in national and local nursing organizations.
Yep.
I attend meetings. I go to conferences. I am I'm the health policy officer for my
Okay.
chapter. I actually will be going to DC next month to meet
Okay.
with the um, congressmen and the senators to discuss the
Mm.
disparities that
Yeah.
health that nurses have identified as priorities.
Right.
I read and subscribe to many nursing journals and
Yeah.
magazines and places like Nurse Deck.
Yeah.
Also, just multiple news media outlets. I read everything. That's my
Yeah.
morning ritual to keep my ear to what's going on. I
Right.
have a very big network. I
Mhm.
utilize them. We're always chatting via text, via email. We send articles back and forth.
Yeah.
So I stay current, and I'm currently working in healthcare.
Yeah.
So that again keeps me abreast. I work for an organization that is always, for anything that's coming out, they're
Yeah.
always giving us notifications and keeping us abreast. So I do a
That's
lot to
great.
stay.
We get a lot of nurses that I think are curious about organizations, but they're not sure either how to join or which ones to join or what they're going to get out of it. But
Mhm.
that's such a great example. I mean, you just are so plugged in,
Yes,
and being able to network too. That's how you get jobs and have new opportunities come your way. So that's
absolutely.
a great example.
Mhm.
And it sounds like something that energizes you
Yes.
as well.
And social media, like I said, is really entertaining. But if you dig deeper and you're
Hmm.
actually looking to actively
Yeah.
listen or get those cues of what is happening in the social realm of nursing, it's very
Right.
important as well.
I agree. I agree. Can you tell us about, I think we've all had the experience of working within a team that morale is low or there's like the one bad apple that's kind of poisoning the bunch. Um, but really working in environments that need an overhaul. And I know you have a lot of experience with
Mhm.
overhauling teams, transforming teams.
Yeah.
Can you give us an example of how you've inspired change within a team or organization?
Yes, so I'm inspired. I've transformed individuals and organizations, teams. I'm
Yeah.
very proud of the work that I've been able to do. I can say one of my shining moments, I was given a job at a very large organization, and it was the trust of the leader who's recognized my talent and just
Yeah.
kind of pulled me in. And I was given the job, but then the job came with, here is a program that needs to be developed. We
Hmm.
have about 15 outdated policies. The
Yeah.
team only has 8 people. It's no direction. Here you
Right.
go.
Here you go.
I'm like, oh, and then he says, don't embarrass me.
Oh, God, right.
That's
Thanks.
okay. So I just took that and that autonomy
Mhm,
alone, the
mhm,
trust that that leader gave me as a
mhm.
new novice nurse leader. I had not even done this job to
Yeah,
oversee a team of 8 leaders.
yeah,
I these leaders were repositioned within the organization as they do sometimes when they're restructuring their leadership
right.
structures, and these leaders were placed on a team to be the rapid response team.
Okay,
So
wow.
all of them were my senior. They had had more experience than me, and here
Yeah,
I am, this new young whippersnapper coming in.
right.
Had a vision, and
Yeah,
the key. I had a vision. I had the tenacity, the endurance, and the desire to
yeah,
see this through. I
yeah.
was able to develop that team. Not, I grew that team from 8 to 21 nurses.
Wow.
I expanded the actual scope of the team. We tried because it was very rigid on, and that's sometimes with nursing. Oh, they don't have enough of this, or they don't have enough of
Yeah,
that. I took the risk of getting people that wouldn't be your ideal candidates
right.
and leveraging them, teaching them. The vision, again, is the
Yeah,
key. You don't need to manage everyone. If you
right.
have a clear vision, they will get on board and do.
Exactly. That's such a good point.
I was able to do that, and that team and that one facility grew to 21. Not
Wow.
only that, during the acquisition process, the hospitals are playing monopoly. They're just buying up all these other little places.
Mhm,
I was
mhm.
able to expand that team to every campus.
Oh, wow.
We grew our rapid response team. We had a unique name that we called it. It was known throughout the organization, known throughout the island, of what we were doing. It
Mhm.
used research, innovation,
Yeah,
technology, partnering with some of the smartest physicians to really elevate. and
Mhm.
advanced resuscitation processes to
Right,
prevent rapid response as well as the recovery if someone
right,
has suffered cardiopulmonary arrest.
right, right.
Right. It was quite an experience.
Yeah, for nursing students that might be listening or watching this interview, a rapid response team is if somebody, falls out in the hospital for whatever the reason is, it's,
Mhm.
often a button you press on a
Yes.
wall or a intercom that you call over. And that's a team that comes running to resuscitate them.
Right.
So I can imagine that's a lot of strong personalities that probably walking into that as someone that's not on the team,
Mhm.
however ill functioning they are at the moment,
Yeah,
that can be intimidating.
it definitely can.
But
I
what an amazing
I had a great
transformation to have it
experience.
expand to other campuses, like you were
Mhm.
saying. That's incredible. Wow,
Yes.
very cool.
And the consistency throughout the organization was key. We needed
Yes,
every team to be benchmarked off of our
right.
flagship team. So it's
Yes,
a lot of work and a lot of travel that I had to do to get these teams to the next level.
yeah, very cool. That's something too that algorithms are so important for rapid response teams.
Oh,
There,
yeah.
you can't have an opinion. It's you just do this next, do this next,
You
and
have to.
so I can imagine patient outcomes were, doing better as a result of a
Absolutely.
better organization there. Awesome. Very cool. Let's talk about nurses in societal view. We went through just in the past couple of years with the pandemic,
Mhm.
the never-ending pandemic. Um, we were put up as heroes, and then we've also been kind of, the politicization. I think there's an extra syllable in there I'm missing, but
Politicization.
the politics that are in nursing right now,
Right.
in terms of like vaccine mandates and that
Mhm.
type of thing, and how nurses have been more vocal in legislature and different policies that hospitals are trying to implement to keep their patients safe and their staff safe. Society's opinion of nursing has changed.
Mhm.
um, what's your take on that? And have you been personally impacted by that in your own work?
Well, I still feel like we are heroes in the image of a lot of people.
Mhm.
Um, I don't know that it has changed. It's changed for some, I would say that.
Yeah,
Because with the recent study, the US study in the workforce, we are still the most trusted. That just
right.
came out last week or 2 weeks ago.
Okay.
That solidifies that nursing is still viewed in a very, I
Mm.
think the public has a lot of sympathy
Yeah,
for nurses, um, for the understanding of what we do.
yeah,
Feel like I feel we have good support, and people listen to us,
yeah,
but it's more of a sympathy. And I don't think that a lot of society, to be quite honest, has interacted with healthcare in the same way.
right,
Some have never even made it past the emergency department. Some haven't even
right,
made it past an urgent care setting. So
right,
their understanding of what really actually happens in healthcare
right.
is very limited. They have limited insight. So
Yeah,
they're going from an emotion. So if there's a good commercial that shows us
right,
working hard, they
exactly.
feel that emotion. But a lot of people, which is good, have not. And I don't know if the people that are interacting with healthcare on a regular are
Mhm.
able or well enough to speak up and say this is what really happens.
Right,
I don't think
right.
the view. I think the insight is very limited. But I do feel like we still have a very good
Yeah,
image in
right.
society.
Yeah, I agree. I think people not pity us, but they understand the struggle that we're facing
Right.
right now and how exhausted nurses are right now. And I know in the beginning when there was the whole PPE shortage and people were sewing masks and
Yes.
that type of thing, I thought that was so
It's very
awesome.
sympathetic, right?
Yeah,
Mhm.
yeah. And I think you're right. I think people definitely still do have that sense of we would help you if only we knew how.
If we knew how,
Yeah,
and I don't think they have enough insight. And once you've interfaced or interacted with healthcare throughout the system,
right.
then you will understand. You will have empathy and see how
Yeah,
sometimes how powerless you may
right,
feel
right.
because it is a big. I call it a. It's like a plane trying
Yeah,
to turn an airplane.
right.
It's a monster.
Yeah,
Healthcare is not. Yes, it's a big, big, big machine.
Yeah, absolutely.
Mhm.
Talk to us about teams that are dealing with a stressful situation, whether it's a department reorganization or reshuffling, or any type of crisis or stressful situation. How do you support teams through that?
I listen. That's one of the biggest things that I feel like we do. We listen.
Yeah,
And once I listen, they want to just be heard, because they sometimes team
right,
members understand, especially for their leaders, they get that you may not be able to fix the problem because you're an
right.
employee as well.
Sure.
But if you listen to them and ask them, what can I do right now,
Hmm.
like at this present moment?
Right.
If there's something that you can do, then do that. But
Yeah.
listen to them and then ask what you can do to help. I also try to to help them focus on the things that they can control,
Yeah. Right.
because a lot of, again, this healthcare monster can eat you. It's so big.
Right.
You're trying to solve all of healthcare problems. You're in
Hmm.
a constant state of stress and anxiety.
Exactly.
Let's
Right.
focus on the things that we can control,
Right.
that I can help you with right now, and let me hear what it is that's going on with you.
Yeah, that's so true. I think that's such a great point about sometimes we see such an immense problem and we feel like we have to come up with immense solutions in order to combat it. But
Yes.
really, often it's the small right decisions made together that can help to solve those problems. So
Yes. And
that's,
supporting their decision making.
yeah,
Sometimes
and
people,
giving them a voice.
yeah, absolutely. I hear you. What is it? Just listen.
Right.
Hmm.
Yeah, that's great. Can tell you would be someone great to work for.
Thank
Um, Talk to us about future challenges, whether facing healthcare organizations or, even if someone is working as a nurse manager. What challenges do you think are coming up for people that work more on the administrative side of healthcare?
So there's going to be more and more of the constant in nursing, and that's always staffing.
Hmm.
People
Yes.
leaving. I remember back in school, and I don't know if you remember, Nursing 2020. That was a constant theme in learning and
Right.
education back then, but I didn't really think about it because it was talking about all of the boomers leaving the industry. We've been talking about this isn't like breaking news.
Right.
So,
Yeah.
more of that. Those people are it's actually here.
Yeah.
In addition to a pandemic that is never probably going to go away,
Right.
in addition to people realizing I may not want to do this anymore,
Right.
and changing fields completely. So I think that that is one of the biggest things, and what we can do to prepare them for the future.
Yeah.
I feel like we can expand our education, or the education of the leaders and even the nurses, the
Mhm.
business side of healthcare,
Right.
because it's no longer are the days of when we thought of how it was. It's more of a business.
Yeah.
And that way, if you learn how to partner with the organization,
Mhm.
you won't feel like you're a victim all the time.
Right.
I am a partner. I
Yeah.
partner with you as a nursing in this business.
Yep.
Unfortunately, that's the way nursing has become, but we have to empower ourselves with that business
Right.
knowledge, and also technology. The opportunities that technology has, I
Mhm.
don't want us to be on the receiving end of it all. I
Right.
want to be the creators, because we
Yeah.
know what works and what doesn't, right?
Right. Yes, I
We build these
100% agree with you.
We're hacking all day.
Right. So true.
All day
It's
long.
so
We're
true.
hacks. And so I think that those things can be a way to prepare the future.
Mhm.
I guess the disease process and teaching us how to care for sick people,
Mhm.
but also preparing us in our business
Mhm.
aspect of nursing, and the future
Right.
of technology and how we get ahead, so that
Yeah.
we're not always on like, here's this new device you have to use,
Right.
and you're fussing about it.
Right, right, right. Yeah, no, that's so true. And also about nursing-led innovation and just how nurses, like you said, we're problem solvers by nature.
Nature.
And it's, if you know a nurse, you know that they can make it work, with what you have. And that's such
Yeah.
a foundational principle of our
Mhm.
profession, I think.
So providing those opportunities when you see it, when I round and I see my team come up with these amazing hacks,
Yeah,
I let them know, do you know that there's a nursing hackathon coming up at
right.
this program? You should enter. Let me help you.
Yes,
Because they're so bogged down with their job, they don't know what else is out there.
right,
So your
exactly.
leadership should be recognizing this talent and saying,
Yeah,
hey,
right. Let me connect
let me
you with the
help
people
you
that can.
help
Yeah.
you get this off the ground.
We had an interview a few weeks or months. I don't know. COVID messes with my time sense. Um, but we had a nurse that we interviewed, Marion Leary, that
Yeah.
runs one of those Nurse Hack for Health
Uh-huh.
hackathons, and I was just amazed listening to her. I'm like, that's so cool. I wish that stuff like this was around when I was coming up as a nurse, and just being
Exactly.
able to be plugged into it.
And why not incorporate that into your staff meetings?
Yeah,
Why not
exactly.
incorporate that into your monthly newsletter to your
Right.
team?
Exactly.
Get them out of the weeds of the day
Yes.
to day.
That's
Need
such a good
something
point.
to aspire to and know that it's more than just
Right.
the things,
Getting through the shift.
the
Yeah,
task. Right.
right. Exactly. That's great. Let's talk about that, in terms of the getting through the shift mentality and burnout with nurses. I mean, I think we can both agree that burnout is widespread.
Oh,
But
yeah.
do you think that, there are any specific things that nurses can do to help combat it, to make it a practice in their daily rituals, so that they don't end up hating their jobs? I think a lot of nurses love being a nurse, but they hate working as a nurse right now.
Right. They do.
Um,
I think one thing to consider is for the public and for people that may be watching this, the nurses don't get to leave the pandemic at the hospital.
yes, right,
It's at home, it's everywhere we go. We don't get a
yeah,
break.
right,
So that in itself, that constant is a stressor. And a
yeah,
lot of times we don't even know that we're the signs of burnout.
right,
So recognizing the signs first
yeah,
is one of the key things to being able to work towards not becoming burnout. I think
right,
you just got to recognize if you're sleeping too much or you're starting to become
right,
weaker, you have to begin to recognize those signs and then begin to do things that you like to do, things
yeah,
that make you happy and not feel guilty about it. But I
right,
do understand the difficulty of you can't leave it at the hospital. It's
right.
at home, it's at the grocery store, it's everywhere you go.
Everywhere, right.
You have the freedom to travel.
Yes.
So you have to create environments of peace, create
Mhm.
environments through things I've learned to pick up. Meditation. I didn't do this when I first was a nurse. I didn't
Right.
meditate and center
Right.
and do self care. I
Yeah,
just went and worked
right.
7 shifts straight
Yep.
to go on my vacation.
Right,
These,
exactly. Exactly.
these guys can't even go on vacation.
Yeah. Right, you never actually get there.
You can't even get to the vacation.
Yeah.
Or wind down in your local restaurant to have your favorite glass of wine.
Yeah.
So all of those things have been shifted. So we have to be creative about tackling burnout. And my tip is recognizing it first.
Yeah. That's a
Those
great
little
point.
subtle signs of I hate my job. That's a big red
Yeah.
flag.
That's a good one, yeah.
And then always remembering your why and setting goals for yourself as well.
Yes.
You can't just continue like this. It's a stream of just, I have no goal, I have no direction, I'm just working, working, working.
Right.
So you can say, during this time, I know that I'm on this job because I need to obtain the tools to be able to get to this job
Right.
or obtain the tools to be able to get the house that I want or the car.
Yep.
Bring an outside source of why or whatever your why is. I love patience.
Mhm. Mhm.
Maybe
Yep.
go back to that. But for
Yeah.
burnout, I definitely think recognizing it, really going back to your why
Mhm.
and finding some kind of ways to relieve stress.
Yeah. Yeah.
And
That's so important, being able to name something makes it less scary. You're able
Mhm.
to tackle it when you
Yeah,
can describe it.
Uh-huh.
And that's true for any stressor, any problem that you have in your life. So for burnout, especially, because it's such a great point about you feel like, you might be having these symptoms, but if you're not mindful about it, then you're just going to kind of sweep them under the rug and get to the next thing. And pretty soon you wake up 5 years later and you're just completely
It
detached.
manifests in another way.
Yeah.
You get sick, or you
Right.
get depressed, or, all these things happen if you're not recognizing it.
Exactly.
And a lot of people, I was talking to someone in a different industry that was suffering burnout and is ready to retire, but and is complaining a lot. And I'm like, well, why are you still there? Well, my two sons are getting married, so remember
Yeah.
your two sons,
Yeah.
helping them get through this.
Yeah.
Focus on helping your two sons. That
Right.
way you have a reason or a purpose to be where you are.
Right. Right. Yeah, I was listening to a podcast earlier this morning, and I don't know if you follow Glennon Doyle.
Oh, yeah,
Nelson.
I have read it.
She had Dr. Lisa Santos on about happiness.
Oh, okay.
And she was saying that, self-care is a big thing, and we talk a lot about that, but she's like, one of the best things is serving other people, getting out of your own head, and she's like, it's something that everybody kind of knows, but to remind yourself that also is beneficial to you. And I think in nursing, obviously our job is caring for other people,
Yes.
but taking on just being mindful of the knowledge, like your example about helping my sons pay for their wedding coming up, it creates a forward thinking momentum that gets you looking forward to the next day rather than dreading it.
And dreading it, right?
Yeah.
You have to figure something bigger than yourself. You have
Exactly.
to.
Exactly. Let's talk about anything that you would like to see. I mean, obviously, COVID-19 was a big fat spotlight that shone on every little crack that was already present in
Yes.
nursing. I mean, we talked briefly about staffing
Mhm.
issues, but what are some of the biggest changes that you think healthcare needs?
So I think, of course, leadership. The way that we even assign our leaders,
Yeah.
that mentality has to change.
Yeah.
I don't know if you have remember the days when someone was just a good nurse and they're promoted to charge nurse,
Right.
or they're promoted to nurse manager. Now you're in
Right.
charge because you were a good nurse. That does not translate to good
Right.
leadership.
Exactly.
It is
Right.
not the same.
Or you've just been there longer than anybody else. Yeah.
Your tenure. Oh, you're the oldest here.
Yeah.
So you're in charge. And it's a trickle down effect, because now you have a big workforce that has had this subpar leadership for generations.
Yes.
And this subpar leadership is still in place.
Mm-hmm.
30, 40 years.
Yeah.
How are you still in the same position?
Right.
You cannot tell me that you are as astute to what's going on with these, not even the millennials, the new people. It's hard. I need to keep.
Right. Yeah. I hear you.
It's not a one size fit all, and we must be more innovative in our leadership when it comes to healthcare. From the CEOs, I don't even know how they're chosen. Who are these people that are in charge
Right.
of the way that we are operating and caring for our public?
Yes.
So leadership in healthcare needs a complete overhaul,
Yes.
and they
Agreed.
can definitely start with nursing.
Yeah.
I am willing to align myself with any organization that is willing to be bold enough
Mm-hmm.
and astute enough to say, and innovative enough to say, hey, we need a leadership overhaul.
Mm-hmm.
And let's
Right.
see what that looks like. I also
Right.
think more technology. I really do. I think to remove some of those tasking from nurses, so
Yeah.
nurses can get back to thinking about disease processes and prevention.
Yep.
We have the skill and the understanding to do that, but
Right.
we're tasking.
Right.
Some of those mundane
true.
tasks, let's leverage technology
Right.
to do those things.
Yeah. No, that's a great point. I think so many nurses, especially older nurses,
Mhm.
hear technology and they hear like, oh God, we're gonna have a new computer rollout, and it immediately elicits fear,
Mhm.
and
Or
just
more work.
yeah, right. Something else I gotta learn, and I'm
Mhm.
gonna retire in 5 years. Why I have to learn this? But there are so many other aspects of technology that can streamline our jobs. And so we're not running back and forth or triple documenting something and,
Uh-huh.
freeing up our time, like you said, because we're great at big picture thinking.
Mhm.
And we're the ones that spend the most time with our patients.
Exactly.
Um, that's a great,
We
great point to
understand
make.
that it is so many things that can help make our job easier. It
Yeah.
really is. So I do
Yeah.
think leadership, and I also want to say more transparency and connection with
Yeah.
C-suite to the frontline teams.
Yes.
That gap needs to be closed.
Yeah.
If
Yep.
you speak to the average nurse at the bedside, A, they have no idea maybe who their chief nursing officer is.
Exactly.
They don't even
Right.
know who their managers are.
Right.
Sad.
Yeah.
And why is the gap? So then when things are going wrong, they're protesting, they're upset. Why hasn't anyone recognized the understanding on both ends?
Yeah.
Even the
Exactly.
C-suite. I don't know when the last time you've been a patient through the emergency department or a patient on
Right.
the unit in your
Yeah.
hospital. And to be quite honest, you're not getting the raw experience.
Exactly. Right. You only show up when like Jayco's coming in after you and you want to make sure everybody has their drinks put away. I mean,
Right.
that's a lot of nurses' experiences of upper management is someone kind of peeking over their shoulder as opposed
Very
to
punitive.
yeah,
No
exactly. That's
support.
there to
Mhm.
support them and work with them. Yeah,
Absolutely. So
that's so
those are
true.
the things I want to see. More technology, leadership overhaul, and
Yeah.
definitely transparency and bridging the gap between C-suite and frontline teams.
Yeah. It reminds me of a conversation I had with someone who was working in long-term care,
Okay.
and she brought up a great point where she says any nurse that ends up going into long-term care, often straight from nursing school because you're trying to get that clinical experience, she said you are almost immediately shuffled into these management roles as an RN because you're managing all these patient care techs who
Mhm,
are actually
mhm.
with the patients. But she says, we don't get this training in school. So you're essentially going from nursing school to management roles and just sort of winging your way through it.
Right.
And I was like, I never thought about that, but
Mhm,
that's so true. And that definitely happens on the hospital level with the amount of turnover that
mhm,
we're getting now.
mhm.
But yeah, there's no real concrete, this is how you manage people and, all that type of stuff. So that's true. I mean, I think the staffing and that type of thing gets overshadows, but that is a huge,
It's a huge
huge
gap
gaping hole, like you said, and that goes on for decades.
for
I mean,
decades.
yeah, that is your system. No system. Wow.
And
Yeah.
that's why the nurse manager coach exists.
Yeah.
I just look for the day where this is I have the voice and I'm in the room and people are understanding what it is that that sentence that you just said. And hearing these people like, I don't know why they gave me this job. I'm just
Right.
here.
Yeah.
And they're burnt out and they don't, and it's just it trickles down.
Yeah.
We have staffing issues because people don't want to stay.
Right.
'Cause no one wants to be a nurse manager, to be quite
No.
honest. They're like, oh, I don't want that job, but why?
Yep, I know. It's true.
It's
It's
a
so
great
true.
position. You are able to really make an impact.
Yeah.
You really do. You can make an impact if you do it
Right.
the right way.
If you do it the right way.
Yeah.
Exactly. Exactly. Let's talk about community. We're huge on community at NurseDec. We love just watching how when you bring people together, the magic that happens when
Yes.
like-minded people are with
Mhm.
people that can truly understand them. And, we see a lot of healing take place, a lot of venting, but
Mhm.
the healing that comes just from doing that.
Yes.
What are your thoughts on community?
Everything that you just said is strength in numbers. And
Yeah,
and if you feel like you're not alone, I'm not a unique person that thinks that leadership needs an overhaul.
right.
I would ask anyone that feels the same way that I feel to join me. Join places like NurseDec where find your community
Yeah,
that is that you're talking about the things that you care about.
yeah,
It is so important to not feel alone because again, with the work that we do,
right.
um, it's not it's not really celebrated for you to be weak or
Yeah,
to have questions or
yeah.
to have concerns. We don't work in that kind of environment.
Mhm.
Yes, some hospitals say, yeah, this is a speak up culture.
Right.
But if you're speaking up and you're not getting anywhere, then you
Right.
begin to retreat and you don't speak up anymore. So
Right.
having that community, even if it's trauma sharing,
Mhm.
venting, but hopefully, like you said, the healing will happen.
Yeah.
You'll find the resources that you need and you'll get the support that you aren't
Right.
getting somewhere else. It's so important to join
Right.
communities like you've set up, like
Yeah.
I'm trying to set up. Because
Yeah.
if you're not getting the support, if you're not getting the support from your employer, you have to be proactive about getting it other
Right.
places. And you are not alone. We're all here. Nurse Tech is here. The nurse manager coach is here to support
Yeah.
you. So I feel supported. I love your platform.
Oh, thank
It
you.
is. It is. It's just great. I didn't have anything like this.
Right. Same with me.
You
Yeah.
know, when I was at the bedside, but as a leader, I can point new nurses who are,
Right.
hey, you have a community that you can join.
Yes. Yeah.
A lot of different things in one place where you don't have to scatter. It is
Right.
great. So, and that way they feel, oh my gosh, and they'll get on there and see, oh, someone's having the same problem as me, or
Right.
someone feels the same way, or someone's in a position that I want to be in.
Right. Exactly. Yes.
The community is so important to help uplift each other, hold each other down.
Absolutely.
Yeah, it's
Yeah.
very good.
I agree. Well, tell us a little bit more about the nurse manager coach. I want to hear more
Okay,
about that.
so the nurse manager coach, the goal is to create a community where nurse leaders feel comfortable learning, and it bridges that gap from if you've been thrown into a position and you're not quite sure what to do next.
Right.
I will give you resources, tools, tips, share my experience,
Mhm.
connect you with the network of other nurse leaders that can help support you
Right.
throughout your journey.
Yeah.
That's what nurse manager coach is. We are stamping out those bad leaders,
Yeah.
weak leaders, leaders that don't want to see change. I'm a
Right.
transformational leader. So
Yes.
when you work with me, I want to see you transform to the next level.
Yeah.
And
Love
that's
that.
that's what it's all about. Transformational leadership, community, empowerment,
Yeah.
confidence,
Yes. Yep.
resource sharing. I don't know how many times I was on the unit and I'm like, I wonder if California, if they even, what are they doing over here for this
Mhm.
COVID
Right.
protocol?
Exactly.
It's more than what's coming out on the CDC or on the website. In the
Right.
actual unit day-to-day
Right.
operations,
Yep.
it's totally different from a one bucket. Yes, that's a guideline. Now
Yes.
I
Right.
need to
Right.
structure this to work for me. Okay,
Yeah.
15 call-ins. What are they doing? Oh, it's
Right.
connecting nurse managers across the nation, across the world to say, oh, this is what we did and it worked for me.
Yeah.
I didn't have that. I had a friend.
Right.
I was lucky to have friends
Right. Exactly.
for many years,
And
but
like you said, in real time when you really need it, you
right.
know? Yeah.
So, creating resources, like I said, a community, a place where they can go and say, today I'm struggling with this. Let's see what the nurse manager coach has to offer. If there's a
Yeah.
tool or a tip or a resource that I can use there.
That's
And
great.
of course, coaching, one on one coaching.
Yeah.
I do interview prep because I noticed that a lot of nurses aren't really preparing
Right.
appropriately for interviews.
Yeah, it can be really intimidating, like trying to get your resume.
And a lot of people aren't prepared for a panel interview.
Exactly.
You understand that you're going to be in a room with 5 people. And as nurse leaders,
Right.
we are interviewing with C-suite. We're
Yeah.
interviewing with physicians. We're interviewing with a lot of multidisciplines. And
Yeah.
how do you prepare for those and put your best foot forward? So
Yeah.
Nurse Manager Coach also offers those
That's
services
great.
in addition to the resources. And of course, one-on-one coaching. So
Yeah.
if there's an immediate need, an immediate problem that you just
Right.
can't find a solution to. I had one of my clients call me today. She's like, I have and this is a client that is in a tech startup. It's,
Mhm.
and she is not even a nurse, but
Yeah. Oh, interesting.
found me and
Yeah.
she's a leader.
Right.
She's having an issue with a team member, and she read she didn't know how to respond. She wants to know
Yeah.
what to say and what these things were. So walking her through
Mhm.
those issues
Yeah.
this morning. So that's what I offer. So real time help,
That's awesome.
one-on-one coaching, interview prep, and
Yep.
a community of tools, resources.
Very cool. That's very cool. I think, like, I remember being in the hospital and you see openings coming up of different jobs, and nurses, we're so often when we're disgruntled or feeling like we've outgrown our current role, we're pushed towards just do more school, add more letters and become a nurse practitioner or do
Yes.
whatever the next rung is. But there's all these administrative or managerial jobs. And I think people just don't feel qualified, or they don't feel like, there's nowhere to go to prep for it. So
Yes.
I love that you're providing that for people
Yes.
and providing support for when they do step into those roles so that
Absolutely.
they're not just floundering there and trying to figure it out on the fly. So
Absolutely. And if
that's
you're in the
incredible.
role and struggling, if your team is a tier
Yeah,
3, they're struggling. You can't get a handle. You have
right,
a lot of behavioral problems
right,
and you don't know what to do.
right,
That those things come up too. And sometimes you don't even know if you're a good or a bad leader. If you have
right.
questions, am I good? Am I bad? Can you do an evaluation of me?
Right,
Help get you to the place of I'm an empowered, I'm a confidence, I'm a
yeah,
resourceful, transformational leader.
right. I
That's
mean,
what
I think we can all relate to working in teams that are just on it. They work well together. They have a
Mhm.
great leader who's like
Yes,
real and
yes,
listens to them and motivates them.
yes.
But when you think about those leaders, I can picture one right now. They're not the ones that are micromanaging every little
No.
thing that you're doing. They just instill this sense of capability within you, and
Yes,
bring the best out in you.
yes,
But how awesome is it that you provide a place for nurses to be able to cultivate that skill within themselves? Because
yes,
it trickles down to the whole organization. A happy team and a team that feels pride in what they're doing is,
yes.
of course, gonna, make better patient outcomes. So
Absolutely.
that's great work that you're doing. I love that there are people out there like you, because nurses need them for sure.
They do. They really do.
Yeah.
And it's
Well,
just
tell
one
us.
of me. So I am looking, I'm building what I can build, but the community
Yeah,
is the key. So, like
yeah,
you said, community is important. You had a vision, or
absolutely.
you guys have this vision for Nurse Day, but
Yep.
it's the community that really helps it grow.
Exactly,
Mhm.
exactly. Well, thank you so much for your time this morning. I feel inspired. I don't have any nurses that I'm working with today, but I'm going to lead my children into something exciting.
Yes, lead them into something exciting. It's a lot of great things happening in nursing.
Yeah,
We can
there
get
really
out.
is.
If we can empower our team to see this profession
Yeah.
as such a beautiful one.
Mhm.
So multifaceted. I mean, look at
Right.
it. It's so many pros. And but I understand that we are part of a system, but we're the only ones that are going to be able to change that.
Yes, I a million percent agree with you. Yeah, and I know a lot of other nurses feel that way too,
Yes,
so
we're going to do it.
we
I'm
just need to.
excited. It's happening right now.
Yep,
Yeah.
yep, I believe you.
You'll see me as a part of that leadership overhaul.
I know we will. Well, great. Thank you so much.
Thank you so much for what you're
Yeah.
doing. I appreciate you guys, Neville, the whole crew. You guys,
Aw, thanks.
uh,
Yeah.
keep it up.
Thank you, thank you.
Thank you. Have a great
Have
day.
same to you.
Okay.
Bye-bye.